Now we'll start one round of 7 minutes with Ms. Sidhu.
Thank you, Chair. Thank you, Dr. Henderson and Dr. Martin Chazen, coming from Brampton, Dr. Chazen and Dr. Henderson, and your valuable presentation. It is a very impressive and eye-opening presentation. And first questions, Dr. Henderson. Does your organization have a recommendation about how we reduce the regional disparities and gaps for palliative care between urban, rural, and on-reserve regions?
We're actually working right now on some staffing models, and as my colleague here says, part of the problem with trying to develop what human resources are required for palliative care is there aren't any good evidence-based models of how many numbers of people that you have. What is out there starts to talk about, well, here's how many physicians you need, and that's all it looks at. This can't be looked at as a physician resource issue without looking at a whole team approach. And that's the model that we're looking at. You also can't look at it from a purely demographic numbers approach either, which is often how it's done. You need X number of doctors per 100,000 people. Well, 100,000 people in an older part of the country versus, say, Calgary, where you generally have a younger population, that same 100,000 people, when you look at those curves, how many people are over the age of 65? Where are the demands at this time? So we're developing a model that really will be looking at the team approach, how many nurses, how many social workers, pharmacists with extra training in palliative medicine, and palliative care physicians as the specialty team need to be in an area based on really even going back and looking at our death rate, because that tells you how many people, as a better number than just pure population, are needing these kind of services. So we're in the process of working on that right now, but that is something that's very much needed. There's great models across the country showing how this can be done, and again, going right back to Dame Cicely Saunders, who was the founder of the modern hospice movement. She said, this is best delivered by an interdisciplinary team. So having access to that good quality palliative care nurse, I honestly see the palliative care nurse as the key ingredient to this whole mixture, especially for community, rural, urban, everywhere, because you can have more nurses out there working with the primary care teams, physicians, nurse practitioners, and so on, helping to guide them a little bit, but helping to ensure the right assessments are being done, the right information is getting to the primary care team, and when it's more complex, then being able to pull in the palliative care consultant to be able to help with that more of that expertise. So I think that's the way we need to be looking and moving forward. So we are working on that, and hopefully over the next few months we'll have some better, more clear. I know what we need. What I can't tell you yet.